Hello, my name is Angela Durden. It is Friday, September 13th, 2013 at approximately 8:30 p.m. Um, Tonight I am doing a video um, for class on basically it looks like provider communication or effective communication with providers. I have this is a subject I guess I have a lot of experience in. I have definitely had some illnesses of my own over the last 3 or 4 years. Also had to deal with some very serious illnesses of a very close family member as well. And so, in those respects, I have had to develop relationships with doctors, nurses, and other hospital staff as well. My contention here is that basically that providers, especially in the public health system, and that's where I have the majority of my experience, but providers in the public health system basically are working under severe time and quota restraints, and that kind of limits their ability to develop effective communication and relationships with their patients. And so, our first question that we are going to work with is, what communication challenges have you experienced with a health provider? And so again, going back to the public health system, I do have a gold card through the Harris County Hospital District. I received most of my care as well through the Harris County Hospital District, either through the Bentop Hospital or at one of the community clinics. At this time, it's the Acres Home Community Clinic. I do receive fairly good care. However, there I have noticed that there's a lack or a resistance to get healthcare providers to talk to me, to explain the diagnosis, to explain treatment options. And I feel like being a someone at this point right now who is low income, I don't have health insurance. A lot of times I feel as if I'm at the mercy of the public health system. So some of the things that I've experienced have been um, number one, the time that it takes to get a diagnosis. I'll explain this is a very personal matter. My kidneys failed about 2 years ago. And it was right at the beginning of the school semester, and so I was stressed already because of that. However, I was put into the hospital and I received very good care at the hospital. I had doctors that were very patient. I had nurses that were patient. Everything was explained to me. My treatment options were explained. And actually they got my kidneys functioning again, which was great. However, I did have a problem with, my bladder stopped working. And so because we couldn't resolve the problem while I was in the hospital, I was forced to go to the urology clinic at Bentop. And so in this happened in January. It took pretty much like 6 months before I actually had a diagnosis. And during that time, I had to get the hospital administrators involved because my appointments were canceled. without anyone calling me or notifying me. And these were tests that I had been waiting months and months on. And so I got very, very disheartened, and it gave me a negative view, I guess, of the hospital system. At the same time, the doctors that I encountered in the clinic setting, they were often rushed. They didn't have the time to sit with me and talk with me and explain what was going on, explain what my options were. Though it was just a very, very terrifying time for me, and it was made worse because of the difficulty and just being in the county health system. The second question is, what skills or qualities are important to me when choosing a healthcare provider? The best doctors I've always had were doctors that weren't afraid to talk to me, doctors that did not feel that they were above me, or that I was, did not have the ability to understand, I guess, my own diagnosis. In that sense, also, I guess, nurses and doctors who will answer my questions. I've had situations with doctors where there was a reluctance to answer my questions, or to even have the patience to listen to my questions, my concerns, or even if I was telling them what my symptoms were. So anytime I have a healthcare provider that's too rushed to sit down and talk to me or listen to what I have to say, that's always a big red flag. But again, being in the county health system, a lot of times you don't have a choice about who you get for a health provider. And in situations like that, there are times when I've had to get administrative staff involved to help me resolve issues. I'm fairly intelligent, and so that's not a hard thing for me to do. But I think of all of the patients that are there that don't have the communication abilities that I have, and so they can't verbally, or they can't even write it out, to tell someone that they're having issues, or what the issue is, or what the problem is. A lot of times, if you hang out at Bentob, like at night or whatever, you'll see that security is called a lot because patients get very upset, or you see patients yelling, or cussing, or just upset because they feel like no one's hearing them out. The third question is, how can I become a better patient? Myself, what I feel that, number one, I can listen to my doctor. And not only listen to him, I can take what he has to say to heart. In other words, if he's suggesting I do A, B, and C, then I need to be willing to be compliant with the treatment that he's prescribing for me. But I also need to have an understanding of what is wrong with me, or what is going on with me. I am a diabetic. And so this was a very, very difficult thing for me not to understand, but I had a lot of resistance because I've known older people that were diabetics, and it was never a good situation. So I was very resistant to even accepting my diagnosis. And so being a good patient is, number one, accepting the diagnosis, accepting that you have a problem. The second thing is listening to what your doctor has to say. And in that respect, too, you have to be willing to communicate with your provider. But not only communicate with them, you have to be willing to honestly communicate with them. And so if there's been issues in your life, if you've had to deal with depression or drugs or anything like that, you have to be willing to disclose those things to your provider so that they can help you. The other thing is that you have to be compliant. You have to, if your doctor says, you have to take this pill at this time, take the pill at that time. If you have a problem with it, be willing to discuss that with your doctor. The other thing is that with being compliant with the medication, you have to also tell your doctor, well, I'm having a problem with the way the medicine is being dosed, or I'm having a problem, the medicine is making me too sleepy. Anything like that. You have to be willing to talk to your doctor, and be willing to work with him as a partner in your health care, and resolving health issues. And so for me, basically, with being in the public health system, understanding uh, that there are limitations to what even a doctor can do, but having a doctor that is willing to listen, having a provider that is willing to answer questions, willing to offer explanations, and also willing to accept that they may not have the answer. Um, it's very difficult for patients in the public health system, because you just don't get the same level of care. And so that's one of the things I'm hoping that will change with Obamacare, although I'm not sure how that's going to affect people in Texas. Um, And also, we can all be better patients. We can all work with our doctors better, communicate more honestly with our doctors. By doing those things, it'll not only help our doctors or our providers be better, it'll also help us in the end. Thank you very much.